Thank you all so much for joining us.
Well, thank you for having me. I really appreciate it. It's one of the things I love doing is talking about advocacy and making sure that families and individuals with developmental disabilities get their voices heard and show them how they can do it. And it's not near as scary or hard as people sometimes think it is. I have 3 adult children. My autistic son is my youngest at 29. I have a 40-year-old daughter who lives here at home and helps me with him. And then I also have a 37-year-old daughter who is a licensed mental health counselor up in Seattle. She has her own practice, and she's one of the few in the state who has a developmental disability specialist attachment on her list of letters after her name. And that's all she sees is individuals and families with developmental disabilities. So my whole family kind of is involved in the realm of, advocacy and awareness, and that kind of thing. So is it okay if I share my screen, Victoria?
Yep, go ahead. Thank you.
Okay, so I want to make sure people's voices are heard, and so that's kind of the name of my presentation. Can you hear my voice? And I love answering questions. If you have them, let me know. And the ABCs of advocacy are: we have to aim to act. We've got to decide, make a decision that we want to do something. And we have to bring the basics to show people what it is that you're dealing with and that you need. And that comes to the call for change. So if something is not working, especially in our system, we have to let them know and tell them this has to change. Under Aim for Act, a big part of that is sharing your personal story. Legislators tell us all the time that people who come into their office or have Zoom conversations right now, it's the personal stories that get to them, that motivate them to do things. They get the high-paid lobbyists coming in their doors all the time, but that doesn't mean anything near what a personal story about you and your child with autism does too. And nowadays, there's lots of ways to contact legislators. Most of them are all on Facebook and Twitter. They text back and forth all the time. I've got a lot of legislators' cell phone numbers, and so when they're on the floor voting on a bill, I can text them real quick and say, make sure this one gets voted yes on. It's a good thing, even if you can't go there or can't take your son and daughter with you, just show them a picture of them and say, here's who I am. This is who I'm advocating for. So it's again part of that personal story issue, put a name to a face type thing. The ARC does advocacy days every Wednesday during legislative session. And what that means is that we hold a meeting. It's been on Zoom for the last few years, but if we get through this pandemic, we probably will go back to in-person and Zoom because that's been helpful for a lot of people. And we just spend an hour and a half with speakers going over a specific topic each week, like employment or residential, different things. And then we help people go around and talk to legislators or legislative assistants at their offices, and just help you to get involved. And we have an action network that's real easy to use, and I'm going to go over that in a little bit. And this season is getting ready now that they finish session, they can start campaigning because it's an election year. So if you have a legislator that you've met or talked to, because they come around to people's doors all the time, and you might want to help in their campaign, and they get to know you that way as well. So bringing the basics, like I said, having a photo of your son or daughter is really helpful. and letting them know the information about what you need for services as far as your son or daughter is concerned. We have a notebook meeting that ARC puts together, a 200 to 300 page notebook that has lots of one-page information on different subjects, lots of charts and data from the Developmental Disabilities Administration, or DDA. And all of that we put online on our website. So you can always access it, look for a page you want, and just take that page and print it out or download it and be able to share that with people. The advocacy days, we've finished those for this year, but as we get them set up for next year, they'll be on our website as well. Just contacting them every once in a while, send them an email once in a while and just say, this is how things are going for us. It keeps them interested in you personally so that you come to mind. When they're on the floor, they make speeches about different bills they're voting on. Many of them talk about, one of my constituents is dealing with this and this bill will help them, and they'll tell the story. They want those stories, those personal stories to share. And the legislative assistant, that's the person who sits at the desk for each legislator. They're kind of the gatekeeper to the legislator. And many of those legislative assistants have connections to developmental disabilities and autism. So building a relationship with that LA, is what we call them, is really important too. You don't have to necessarily talk to the legislator. If you talk to the LA, the legislator will hear from them about it. And Facebook, Twitter, there's lots of information we put out on there for folks to access too. And in November, typically, there are a lot of legislative forums or coffees that you can attend and talk to legislators and sometimes those who are running for office as well. So we have advocacy days. I talked a little bit about that. Some of those advocacy days have rallies at the Capitol, and we've had up to 1,000 people for developmental disabilities on the Capitol steps when we do rallies out there. And that gets their attention when they see a huge number of people all rallying and holding signs about, a specific issue. It makes an impression. But you can also, there's a lot of different things out there that, talk radio shows, letters to the editor, a lot of different ways. And you can get creative. You don't need to just stick to a list like this. But think about how you might, I run into agency people and legislators in my grocery store. I used to anyway when I was going out to it all the time. So there's all kinds of ways that you can connect with them without taking a lot of time. And right now they're setting up all virtual meetings pretty much rather than in person, although I think we'll probably be getting to the point where they'll start doing more of that. And we have a program called Self-Advocates and Leadership that's part of the ARC. And those are all individuals with developmental disabilities, adults, who get together and they decide on what legislation is important to them. And they talk about those different bills that have come up, and they talk to legislators, make appointments. They meet with the governor's staff every month. So if you have an adult son or daughter with autism, that they hold a meeting every month. You can be on Zoom, or they hold the meeting in person up in Seattle at the airport. So when you're contacting them by Zoom or any other avenue, really, you want to pick one issue. Usually if you get an appointment, it's like 10 minutes, maybe 15 during session. Now, off session, like now, they're going to have a little more time. And so you might get a half hour. But you don't want to confuse them with too many issues. So pick one, and then you can talk to them more about others or email them about others later to follow up. and tell them what the issue is and how it's affecting you and your son or daughter and your family, and what should change, what needs to happen to fix this problem. And it's really good when you're in person, um, to put all this down on paper and leave it for them when you leave. And then they have that paper around to remind them of your visit and what you talked about. And you can send this by email. Right now when we do Zoom meetings, we follow up by email, and so you can do that as well. During session, which, like I said, just ended yesterday, there's a hotline that you can call. And when you call, you can just leave a brief message and they will automatically send it to all three of your legislators and the governor if you ask them to do that. And I'll give this presentation to Victoria so that if you want to be reminded of anything that's in here, especially for next session, you'll have that information. So contact by mail is really tricky because of all the security stuff nowadays, and most people don't write handwritten letters. So if you do write one, when it gets to the legislature, it makes a big difference. I know people don't do that very often. And they estimate that for every one voice that they hear from in Olympia, it represents about 10,000 other people who don't bother to call or contact. So your voice is pretty powerful when it's not really just representing you. You're representing a large number of people who just feel the same way you do, but don't speak up. One of the things we always ask people to make sure they do is say thank you. Legislators do not hear that very often. They hear lots of complaints about what they've done or what they haven't done, but not a lot of people say thank you for what they're trying to do. And then, unfortunately, it's the system we have, where it's a partisan system. We have Republicans and Democrats, and they may feel pulled on an issue, but their caucus, their party, does not want them to vote for it. And we've seen things like that happen before, where they really are interested in the issue, and there's a bill, but maybe they feel the bill just doesn't quite do it, and so they vote no on it, even though they really are into the issue and would like to do something, that just they don't vote on that particular bill for it. And you can get legislative addresses for the mailing and address on the website there. Emails are pretty easy. If you know your legislator's name, you just use their first name dot last name at ledge.wa.gov. So all the same information, your name, and pick an issue and then tell them how it affects you and what needs to be done. And you don't have to give them the answer of how to fix it. If you don't know, that's fine. Just let them know this is a problem and we need to have this be the outcome. And it's their job to figure out how to get there. And like I said, everybody's into social electronic media nowadays. Instagram, YouTube, the archives all of those different accounts. We also have an action center, and I'm going to show you that in a little bit later, and hopefully people will sign up for that, because it's very easy to use and gives you a chance to have your voice heard. So what do you talk about? Well, you've got your personal experiences, first of all. I know the one mom, I forget which one it was that I just heard from, said she's just trying to survive. And most of us, I think, have been there. We've all had those times when we're just trying to survive. Those personal experiences, they want to hear about, even if you sit there and cry while you're trying to tell them. they want to know those things and try and figure out what they could do to help the situation. When we hold advocacy days, you can talk about the topics. We have one pagers every week that goes with them, so you share those with them. On the budget and the bills, you'll see in a little bit, we keep a chart of the budget items that affect people with disability, developmental disabilities, and a list of all the bills that affect people. So we keep those updated on our website, so you can always go there and look at them and talk about something off of there that affects you. And just tell them we need change. This needs to pass. This needs to happen. And you can invite them to things. They love attending, especially like I said this year, because it's an election year. They want to be out and about and talking to people and meeting new people. So you can set up a time just to have a small gathering, at your home or in the park or something, and invite them to come and talk to people there and let them hear what the needs are. So when they do get elected, if they do, then next session, they're going to have your voices in their head when they go sit at that table. And always remember to say thank you. So these were our advocacy days for 2022. We have a new group that started this year. There's over 200 people on it now, called the North Star Coalition. And the Washington State Developmental Disabilities Council put this group together to try and get the voices of people to find out, here's all the things that people with developmental disabilities need, and here's the barriers to getting those things. And we had 719 different ideas that came out of this group just this year. And we went through, we had 8 different groups. Each of these have an advocacy day for the group: housing, civil rights, employment and day, transportation, so on. And there's one more: systems accessibility, that kind of goes in all of them. And so when we meet, you can join any one group or all the groups, how, whatever your interests are. And you can have your voice heard in those. And we have a Google spreadsheet where all of those items that they come up with are listed online and anybody can access them. So North Star Coalition narrowed it down to 19 things that we approached different legislators and asked if they would sponsor. Out of those 19, 6 things came to pass this year from that group. And 6 may not sound like a lot, but this is a supplemental budget year. Usually nothing happens except just whatever they need to do to fix the budget from last year. But we got a lot of new stuff that moved forward, and a lot of legislators who got new information. And the biggest thing that came out of it, now, I mentioned a caucus before. There's a Republican caucus and a Democratic caucus. And that just means that group of people meet somewhere because they're all got that same interest. Well, there are also other caucuses, like the Black Caucus. There's a number of Black legislators who are part of that one. We finally, after years of asking for one, this year, because of North Star, got a DD caucus. So Senator Randall is leading that in the Senate, and Representative Jamila Taylor is leading it in the House. And we have a number of other legislators on it too. That's going to be a huge help next year. It's got put together during session, and this was a short session, so we didn't get a lot moved forward. But we are really hopeful for next year that the DD caucus will help us get more stuff over the finish line. So your story can consist of a lot of things. Our biggest issue over the last few years has been caseload forecasting. And I say that because in our state, what caseload forecasting is, for those who may not realize it, is that we have a caseload forecast council. who tells the legislature, okay, for this program, say Medicaid personal care, the community first choice, this many people are going to need that service next year. And so legislators plan their budget around, okay, we need to fund for this many people to get this service. And when you are part of caseload forecasting, that becomes an entitlement. That means if you qualify, then you get that service. Now, in DDA, that's not the case. DDA is the only state agency that does not caseload forecast. And because of it, we have 12 to 15,000 people on the waiting list every year. There is no waiting list if you go to aging and long-term care. If you're an adult with autism and you can't get services through DDA, you can go to ALTSA instead and apply there. And they have Medicaid waivers that you can get in and get right away because there's no wait list, because they're caseload forecast. And that's why it's costly for them to, caseload forecast DDA services. It means all those thousands of people on the waiting list would actually get served, and it's going to cost money, but it's the right thing to do. And this year, what we accomplished was getting what they call courtesy caseload forecasting, which means they'll look for the numbers, but they're not an entitlement. They'll let the legislature know when these number of people want this, but there's no entitlement that says they get that service unless the legislature decides to fund it. It gets tricky with DDA because the ARC sued DDA years ago for having a waiting list because legally they're not allowed to. And so they changed the name of it. It's called the No Paid Services Caseload. It's still a waiting list. It's still called one now. Then they have what they call a request list. Now, if you're on the No Paid Services Caseload, first of all, you need to know that you can request a specific service. Most of those people on the No Paid Services Caseload have no idea. But if you want, say, a basic plus waiver, you need to request that, or they don't even put you on the list for it. And most families do not know that they need to be requesting a placement on a waiver or whatever program it is that they feel their son or daughter needs. So we're working on a lot of issues around that with DDA as well as legislators. But if you're sitting on a wait list or on the no paid services caseload or a request list, those stories are things you need to share with legislators because they need to know that. Maybe services that you were getting and you lost them. That's happened with personal care. We lost hours one year. And maybe just a system experience that hasn't gone right. All of those things are things that they can work on, but they won't unless they hear from people that it's something that needs to get done. In the budget process, here's another piece of our dilemma. 70% of the budget is untouchable, either because of constitutional law or rules from the Center for Medicare and Medicaid, CMS. And so the budget process takes place every year. The odd number years are the biennial budget, where they're planning for 2 years how they're going to budget their money. And then the next year is the supplemental, where if they had a shortfall, like when we had the earthquake, the next year they had to come back and put more money toward the capital because of all the damage done from the earthquake. If there's emergency issues, they will address those. And sometimes a bill dies, but it can be part of the budget, so they'll stick it in there as necessary to implement the budget. So that's kind of an overview of the budget process. It starts in the spring when DDA has to put together what they call a decision package. This is what we want. And then in the summer, they work on those DPs for the governor, give them to him in the fall. He comes out with his budget proposal mid-December and it goes to the legislature, then the House and Senate each provide their own proposal, and then they got to sit down and do a conference committee to decide what will be in the final one. And they just voted on that yesterday. The bill process is kind of extensive. It has to go through several committees, a policy committee. If it needs money, it goes to the fiscal committee. Then it has to go to the rules committee to make sure it's not going to violate some state law. And then it has to get to the chamber floor for a vote. Once it makes it through one House and Senate, say, then it's got to go over to the House of Representatives and go through all that same process. And then if it makes it through both of those, then it goes to the governor where he can sign it into law if he wants. So this just gives you an avenue of all the yeses and nos where a bill can end up dead during the process and not make it through. So where do you find updates? This is I'm going to share my screen with another view here. Okay, so this is our website, arcwa.org. And if you go to advocacy, you'll see there's a number of things. The legislative notebooks are kept here for each year. Advocacy days, you can go watch videos of every advocacy day. We record them all. We'll talk about the Action Center in a minute, but I'm going to go to the bill tracker right now. And so in the bill tracker, we have the bills of interest up here, and we have the budget proposals. Now, this hasn't been updated since yesterday. We'll get this final one in here today. I'll be putting that up. But there was, transforming services by doing caseload forecasting for all DDA services. The governor put that in his budget proposal, but the House and Senate did not, and it didn't make it in the final. They did put a courtesy forecast in the final, but that still doesn't get rid of our wait list and doesn't get us all the services people need. Then I go back here, and the bills of interest. These are updated every week during session, so you can always go look here and see, where things are at during session, and afterwards see what bills passed and didn't. This year, now remember I said this is a supplemental year that's usually meant just to fix things and not put new money or new programs in place. Yet through North Star, we got new stuff in here. There's one in particular I want to call your attention to, and it's House Bill 2008 here, eliminating IQ scores. This is a huge issue for people with autism trying to access DDA services. This is no longer going to be a qualifier to get DDA services. So you don't need to worry about IQ. It's going to be based on their need, on their daily living skills. This is a huge thing. We've been fighting for it for a long time. And Representative Taylor took up the charge, and she got this passed for us. So this is a huge issue, and I wanted to make sure you guys are all aware of it, so that if you have families who have struggled trying to get into DDA because of an IQ score that was just a little bit too high or something, know that this change is being made. And if any of you are inclined to do so, sending Representative Jamila Taylor a little email saying thank you for her work on this bill would be really good. Another thing that we got, this is another new thing that they put in a supplemental budget. The no paid services caseload back in 2011 when we had a budget crunch, the legislature took away all of the case managers. So They had a high caseload. It was, pretty 1 to 500, but at least there was case managers there for people to access. For years now, there has been no one for them to talk to, an 800 number that usually doesn't ever get responded to. This year, Senator Braun got them to hire 2 full-time case managers for the no paid services caseload. And they'll be contacting families, asking them what services they want, and providing a report to the legislature. So we're getting somewhere, at least baby steps forward. And in a supplemental year, this to us was amazing to get. So know that that part is being worked on. Increasing language access in public schools has been an issue for years. Representative Orwell's been running this bill for a number of years. People who do not speak English as their first language. In the school system, interpreters don't understand IEP language, the individualized education plan. They don't understand it, and they don't translate it right, and then families are left so confused. And so this bill is going to change that. It's going to get training in there, and technical assistance for interpreters to be able to be using the right language to help families communicate with the teachers and others who are working with their son or daughter. Again, another huge thing for us. Here's another one, House Bill 1980. And again, this was Representative Taylor. She was a huge champion this year, and she's newer to the legislature. But prior to the 2008 recession, adults with developmental disabilities, they could get employment services and maybe work an average of 4 to 10 hours a week. And then they would also get community access, where they would have a provider who would help take them out into the community to, socialize and interact with people in the community. So they got both employment and, the fun, recreation piece of life. And that's what all of us do. We all have our jobs, and then we have other time that is not our job. Well, in 2008, to save money, the legislature said, nope, you got to choose one or the other. You can have a few hours in the employment service, or you can have a few hours out in the community. You got to make a choice now. And that's been really hard. It's really isolated people. And Representative Taylor got that back. So it's no longer either or, you get both again. And that's a huge thing for adults. The last one that I'll touch on is the last bill here, Senate Bill 5268. This is the one that we had our hopes pinned on for caseload forecasting. It started out last year with caseload forecasting as a courtesy, and then the sponsor, Senator Kaiser, agreed to take courtesy out and put just regular caseload forecasting in. And we were thrilled. And then they changed it back to courtesy. So we really didn't get what we were hoping for out of that bill. It also includes language about using the residential habilitation centers, or RHCs, for crisis care. And there's a lot of mixed feelings in the developmental disability community about the RHCs. Self-advocates hate them and don't want them. Families know they got to have something until the community gets built up enough that we have what we need in the community. And so I'm going to show you a little bit of how we're doing that. I'm going to go back here to our web page, and I'm going to click on the budget proposal page. And can you guys see this okay? Is it big enough?
Okay. Yes, we can.
Okay.
Thank you.
So you see here, Senate Bill 5819 was the 2 case managers for the no paid services caseload, and that did get funded. Community supports. We got 6 3-bed homes for intensive rehabilitation services and 6 3-bed homes for enhanced out-of-home services. And those are for the kids, for children, and then the youth age 21. So that is going to help build up some of that crisis in the community, crisis supports. There's also one for adults. Scroll through here and find the right one. And part of it was increasing rates for people who needed services, because the rates are so low that you can go work at McDonald's for the same amount you're taking care of someone with challenging behaviors. I'm blanking and not finding the adult one, but I know it's in here somewhere. But we have both adult and we did last year too. They put money towards both adult and children community crisis care. And there was in the budget to begin with, it was 2 16-bed facilities specifically for people with high behavior needs. And that's because we've got so many people, children and adults, who've been stuck in hospitals because, either the family or a residential provider can't handle the behaviors. So I take them to the emergency room, drop them off, and then won't take them back. And we've got one family we've been working with a 12-year-old who's been sitting in a hospital room, no windows, can't do anything except stay in that one room. And he's been there for months. He spent Christmas in there. It's just, terrible how our system has devolved. But I'm pleased to say legislators are really listening. There was a lot of news articles about this young boy and a couple others over the last couple months. And legislators are paying attention. The cost of keeping someone in a hospital room is way more than it would be to get them services they need that would help them, de-escalate and be able to go back home or back to their residential placement. So we are hopeful that next year we're going to see another good budget piece where they'll pick up the caseload forecasting and actually do that and continue to build crisis supports in the community, so we don't need to use the RHCs for that. Because right now we've got, if you want planned respite, one of the places that they always point you to is Yakima Valley. Well, who wants to drive clear over to Yakima to drop their son or daughter off for a week and then have to drive back? And then when it's time to get them, have to go back to Yakima and drive back, and if you're way far in one corner of the state or other, that's a long drive. That's not much respite. So this is where you can always find this information. And like I said, it'll get updated today from yesterday's session cutoff. So I'm going to stop this one again. And we'll go back to the presentation. And like I said, I'll give this presentation to Victoria and make sure that you guys can access all of this information. So we have our action center, and I should have toggled to that while I was over there. But this gives you an idea of the federal legislation, which is where we're working at now that the state legislature is done. We're working towards the federal Congress people. We've got 2 senators that cover everyone in our state, and then there are 10 districts with a congressman or congresswoman for each person. I live in Tacoma, and so Derek Kelmer is my congressman, and he's quite familiar with me. We talk all the time. But there are a lot of bills in Congress that will make a difference to us too. The big one is the Access Act, HR 77. That's where we're going to get caseload forecasting kind of at the federal level. The home and community-based services, those are the waivers that our state provides. And every state does it differently. But the federal government does not fund it enough for each state to do it on their own. And yet they do, many of them do. And like I mentioned about aging and long-term care, you could go in that door and get served right away, where you go in the DDA door and you can't, you go on a wait list. Well, if you look at the numbers, DDA, Washington State, is number 41st in the nation for providing community services to people with DD. ALSA is number 2 in the nation for providing those same services to mostly elderly, but there are a lot of people with DD that are in that system as well because they could get served. The only difference between those two systems, they provide the same programs and waivers through Medicaid, but one is caseload forecast and one is not. But the federal government, we want to provide more funding, so that will help spur our state government to say, oh, okay, well, if we can get more funding for it, then we'll do it. And that's been the problem right now. So you can do a search on our Action Center and look at a lot of these different bills that are going on. If you click on them, it'll tell you what the bill is about. We've got a lot of Social Security stuff that has not been raised since 1984. They haven't changed that program. And that's a long time. And so people still are at the $2,000 limit. You can't have anything more than that. You can't get help from family or friends. You're not allowed to take help. The rules are pretty strict. And like I said, they haven't been changed for so long. They're very out of date. So there are a number of bills to change that. The marriage penalty, if a couple with developmental disabilities gets married, they lose half of their income just about. Everything gets affected, and again, they can't have family help them. So like I said, there's a lot of stuff we're watching and acting on right now at the congressional level as well. And we keep you updated about that stuff. So why do you matter? Well, 97% of congressional people said in-person visits influenced them. 97%. So if you make one in-person visit, and that Zoom counts as that nowadays. So you don't have to go anywhere. You can just make an appointment, find your congressperson or your legislator, make an appointment with them, and just talk about your story. And then 88% say that personalized emails influence their decisions. Now with the ARC, with our Action Center, I'm going to flip out again to that. Because I want to make sure, I should have done that the first time, but I want to make sure you guys see that piece. Okay. So when you go hover over advocacy and you go down here to the Action Center. Okay, so this was our alert for making sure we got the DD services in the legislative budget. And this second one is about the Social Security program and the changes. This one's still active. This one will go off today. But you can easily just act on a program, an alert, and it will bring up this. You'll get to read what the alert is about, give you a little bit of the synopsis and what needs to change. You fill out your name and address here, and up here, the message, there's a subject line. You can change that if you want. Put your own personal story in here, And then this gives the legislators the information they need about what needs to change. But your personal story will show up first. So this is the only thing you really have to fill in. It's just write your story here, put in your name and address, and send the message, click send, and it will go to your congressional. They know who your congressional leader is just because of your address, your street address. Very easy to use, and we make it as easy as we can by giving you the information to be able to act and be knowledgeable about, you know, what the issue is, enough that you get what you need from it. Going down here, finding view key legislation is what you would click on to go where I showed you the federal legislation that we're tracking now. You can sign up for the alerts right here. And we have blog posts that we put in here sometimes if there's something important. The wrap up from yesterday will go on here today as well. So that basically is the end of my presentation. So are there questions?
I don't have any questions. That was a lot of really great information. I feel like I'm always learning.
Me too.
The process can be a little overwhelming, but I just wanted to add that getting involved as a family can also be really empowering. I think that we forget how much impact we can have as families with our stories. So I would encourage people, if they have an opportunity at future advocacy days, to go bring your sons or daughters with you. It's a really powerful experience to see people who are, you know, the people who are impacted by these things speaking up for themselves. And there's just a really powerful energy when you attend those events. And I also wanted to share, we have 2 legislators here in our district, Representative Peter Abarno and Senator John Braun, who have been great advocates for developmental disability services. So we're lucky to have them here in Lewis County. If you have an opportunity to meet with them and share your story and connect, I encourage you to do so. So I know I saw Braun had actually, I saw his name a couple of times on there. And I know that Peter Abarno is somebody who's championed inclusion in our community, and he's really big with supporting our Special Olympics team. And so we're lucky to have them here representing us.
Yes, Representative Barno sits on the capital budget, which is a different budget than the operating one. But I've met with him a number of times, and yes, he's really good. He has a heart for people with DD, and yeah, he's on my Facebook. I see all the Special Olympics stuff, the polar diver, I forget what they called it, but yeah, Peter Barno, and then John Braun, Senator Braun, is wonderful. He sponsored the bill that passed to get to 2 case managers for the no paid services caseload, to at least get a start to that. And he was really, although Senator Kaiser was the sponsor for our caseload forecasting bill, he was the, you know, alternate sponsors for the Republicans. And he was the one who put all the energy into that bill. We didn't get a lot of support from Senator Kaiser, but Senator Braun was just wonderful. And he's great to work with. And so is Ruth, his legislative assistant, is just wonderful as well. And like I said, you know, even if you can't get to the legislators, knowing those legislative assistants is also very important. But thank you, Sarah, you're right. It's really good for families to be involved, and you've got a couple of great legislators there.
Does anyone else have any questions?
I don't really have a question, just thank you for the information. I also, the IQ testing for autism being dropped is obviously a huge one. I, as a parent-to-parent coordinator, run into that so very often. However, I'm still interested to see what takes that place. I mean, I'm assuming they still can't just say that anybody with an autism diagnosis is going to qualify, or is
Oh,
that?
no, that's not true.
Yeah.
One thing that changed, and maybe this history will help a little bit, we had the DSM-4 that had,
Yep.
the criteria for autism. And then they changed to the DSM-5. When we were at DSM-4, IQ was not a part of it. They didn't have to have that in order to qualify. DSM-5 came around. Myself and a number of other advocates worked with DDA. We had a stakeholder group to decide what the criteria would be out of that to qualify for autism. And I have the DSM-5. I've read it many times. It tells you in there IQ is not a good way to measure autism.
Yeah.
And
Oh, for sure.
yet DDA decided to add it on as a way to save money. Less
Yeah.
people qualify if you have that IQ qualifier on there. But it's actually your daily living skills. What is the services, the problems you have getting through the day, whether it's feeding or toileting or eating, trying to cook food, do laundry, all those things that so many of our kids and adult kids even don't do well. And those are what they now will have to base it on. You'll have your diagnosis first to see where that fits, but then you'll have your activities of daily living, and there won't be an IQ score in there.
Yeah. That's very good for a lot of our families.
Yeah, that was a huge thing.
Yeah. Especially for some of us, your kid's like right on the borderline there sometimes, and you're like, what happens when my kid is so barely over that line, and you're telling me that they won't qualify for this, but it's pretty obvious that they still need the support. Like,
Yep.
very, very sad for a lot of families. So
Yeah, that was a huge thing this year. Any other comments or?
Well, I guess I just have a question because I've been watching a couple bills really closely as the county coordinator. There's some things that will potentially impact employment and day services. Pretty exciting. So right now they've made it to the governor's desk. So what can we expect as we're watching those? Are those pretty much passed and we're just waiting for them to get signed, or are they still up in the air?
There's still a little hairline of up in the air, because the governor, when it gets to his desk, he can read the bill and say, yep, I'm going to sign it. This is a great bill. And he could also say, read it, but this one little paragraph here, I don't agree with, so I'm going to strike that and veto it. Or he can veto the whole bill. Now, it's unlikely he'll veto the whole bill. We work with the governor's office all the time. And so, it's going to be important I will be watching as he signs each bill to make sure there was no parts that were vetoed. We have the concurrent services, that bill, and then we also have school to work. It started out with employment providers trying to get a higher rate increase, but it also had the school to work piece in it, expanding that throughout the state because only a few counties have that. And that part, they took out the rates piece, but they did pass the school to work and the transition work group that we had put together and working in will continue and do a lot of work as well. So yeah, those two are big, county bills I know that they've been watching.
I don't have a question, but I'm just super excited to hear everything you were sharing. Like, thank you for taking your time. I'm really excited to see, or hear about more information or when that starts, like of the no IQ aspect, because with the position I've had, like I just know so many families who they've struggled with the tasks of daily living, but the IQ part was the big reason why they couldn't access services. So that's, I think, a huge win, and thank you so much for all your work that you've done for advocating. I'm excited to just kind of learn more and like dip my toes into I think the thing that you said that really impacted me a lot was writing a letter, or how one voice can represent 10,000. Because I think a lot of times as parents we're like, yeah, well, someone else will voice, someone else will write a letter. So just hearing that part of it really impacted me, and it's like, okay, that is something that I can set some time out to do, is just write a letter. So thank you for that information.
Well, and just for information too, most of these bills, once the governor signs them, take effect at the beginning of the next fiscal year for the state, which is July 1st. So sometimes a bill will go into effect immediately if it's deemed necessary, but the majority of bills that get signed start July 1st, unless they say something in them that they're for next year or something. But the IQ bill will likely start July 1st. But DDA already knew this. We've been working closely with Debbie Roberts, who's the secretary for DDA. And, she knew it was coming and is embracing it. We have new leadership at DDA now. And that's made a huge difference. We've got a really good, solid relationship. We have a meeting called the Community Advocacy Coalition that meets every month, and they're organizations from all around the state focused on community DDA services. She attends that meeting and spends an hour with us every month going over our questions that we have for her and anything new. So I'm anxious to see what Debbie will do with this and how soon she'll get things implemented.
Yeah, thank you.